Also, the level of vision that people had when they entered the study ranged anywhere from 20/30 to 2100. So there's some people who were missing some vision, but they only had the intermediate form of macular degeneration when they entered the study. So it's a particular select group of people. Now, this treatment has been evaluated in two studies. One is a continuation of the other. And we have two publications to review as scientists to say, do we believe in this or do we not believe in it? One of them was published a while ago. It's a 13-month study. And then all the patients within that 13-month study, they were continued until the whole treatment session was done for a 2-year period. In other words, we have now up to 24 months of data for patients who were treated with this. If we look at the kind of people who were treated, there were 100 patients in both arms. In other words, this makes sense. This is a continuation from one to the other. They were evaluated in the first study after 4 series, that is kind of midway through, and the results were published. And then they were evaluated after the whole thing was completed. I think it's a really good sign that they did a bunch of internal checks of quality. That is, in some studies, someone will do a thing and they'll look at the images themselves and their bias might alter the outcome of the study. Whereas in this study, they actually took the images of the patients who were treated and they sent them off to a third party, another group of people who have no interest in the outcome of the study. I think that's a really nice thing that they did. And they only studied really one thing, best corrected visual acuity. That's what this means. Best corrected visual acuity. That is, how many letters they could see on a specific kind of eye chart. This is not the eye chart that you and I would use in like routine practice, what we call Snellen visual acuity, where you have like a screen, it's blank, except there are 5 letters, and you have to read those letters, and we say, oh, your vision's 20/20, 20/40, 20/30, whatever. Rather, the kind of eye chart that they used is a special kind of eye chart. It's only used in research settings, called the ETDRS chart, the Early Treatment of Diabetic Retinopathy chart. It was developed in the 90s to help people understand the visual acuity of someone who has diabetic retinopathy. But it's actually applied to other studies now. And this was the endpoint that was assessed in this study. Now, there were some other, what we call secondary endpoints. That is, besides the specific objective of measuring someone's visual acuity with this special chart, there are other ways that we can measure acuity. For example, low luminance testing. If the light is low, how do people fare? Contrast sensitivity, the eye's ability to discriminate a white from a dark thing, we call that contrast sensitivity. And the researchers were interested in knowing, was there a difference between people